my name is Paul Chin. I'm with Sterling Ridge Orthopedics and Sports Medicine. I'm an orthopedic sports medicine surgeon. Today we're going to talk a little bit about hip pain. And one of the most common questions I get about hip pain is, number one, what is this hip pain? And so what I usually ask patients, number one, is, well, where is it? Because hip pain can vary based on location. So the most common type of hip pain that we'll see in the clinic is either impingement pain, and that's usually a younger person, or arthritis pain, and that's usually a little bit older person, and almost always that hip pain is in the front of the hip joint. So if you've got pain in the front of your hip joint, if it's kind of right in that crease where your femur comes up into the pelvis, that is what we consider anterior hip pain, and then we kind of break it down. Are you kind of younger or are you older? And if you're older, it could be arthritis. And in most patients that have arthritis, they will have noticed pain in the groin, pain that most commonly it's in the morning when you first wake up. It's kind of what we call this get up and go pain, where you can sit for a while or you wake up and it just feels like it's stiff. It feels like it just won't let go. But as you get moving, it gets a little bit better. And many patients will live years with hip arthritis pain that just slowly gets worse over time. Occasionally it can develop really rapidly, and in those cases, more aggressive treatment is needed. But in most patients with arthritis, typically hip arthritis, what we'll see is a slow progression of damage and a slow progression of their symptoms. If you're younger, like we talked about, and you have anterior hip pain, that could range from just a muscle injury from a sports accident, or it could be impingement, as we've talked about in other videos. Femoral acetabular impingement is commonly a problem where people have a bony abnormality, and these bony abnormalities lead to abnormal contact between the ball and the socket joint, and then that leads to damage to soft tissues, it leads to pain, and it can lead to lots of other problems. And so that anterior hip pain is something that's very, very common. The second type of hip pain that we commonly see in the clinic is lateral hip pain. And so lateral means it's on the side of the hip. And commonly it can be on the side right next to the bony prominence, which is called the greater trochanter, and sometimes it can radiate down the side. And so we'll see this lateral hip pain in lots of different patients. We'll see it in patients that are young, like 4-year-olds that are walking in and they're limping. We'll see it in patients in their teenage years when they have sometimes either a hip pointer or they have IT band problems. We'll see it in middle-aged patients that are running and trying to run for that marathon, and they'll get trochanteric bursitis and they'll get IT band problems, they'll get a big flare-up. And then we'll see it in patients in their 60s and 70s, and they actually have tendinitis more than anything else. And more common, it used to be called trochanteric bursitis. Everything on the lateral side of the hip was called trochanteric bursitis. But now we know that there's a constellation of symptoms. There's actually a term called greater trochanteric pain syndrome, which means that there's a syndrome of pain involving usually swelling, inflammation, pain, again, on the lateral side of the hip, and sometimes it can move to the front, sometimes it can move to the back. But in this greater trochanteric pain syndrome, which is common in our more older patients, they usually have tendinitis. Sometimes there's a bursitis component, which again, the two things are tendons mean that the muscles of the hip are getting inflamed, and the bursa is the space between the muscles and the soft tissue that gets inflamed. But either way, most of these patients get better with a combination of doing some anti-inflammatories, doing some physical therapy, occasionally and rarely some injections, and even more rare surgery. So that's the second most common type of hip pain, and that's that lateral hip pain. And then there's posterior hip pain. And posterior hip pain is a little bit of a black box. There's another diagnosis called deep gluteal space syndrome, which, as you can imagine, just describes the location deep to the gluteus in a space. And so that involves lots of different things. It can involve sciatica, which many people have heard of, which just means if you've got pain probably related to the sciatic nerve, it's moving down the leg maybe. You can have pain from something called piriformis syndrome, where that's another syndrome that most commonly involves compression of the sciatic nerve along the piriformis muscle because of either an aberrant piriformis or an aberrant sciatic nerve, or just too much working out that leads to compression of the sciatic nerve. Sometimes you can have what's called ischiofemoral impingement, which is another type of impingement that occurs around the hip, where the bones of the femur collide with another structure in the pelvis called the ischial ramus. In some patients, you can get hamstring strains and hamstring tendonitis, but again, posterior hip pain is generally a completely different entity than lateral hip pain or anterior hip pain. Occasionally, these hip pains kind of meld together, and people have front and lateral and back pain, and then we're just a big question mark. But in general, we get x-rays, we try to discern, okay, well, what started first? When did it occur? Was there a fall? Was there a slip? Was this a skiing accident? And eventually we'll kind of hammer down the exact cause, and sometimes we use differential injections to do that, and even more rarely surgery, but we have to very specifically diagnose, well, what is the main thing causing this? And the wild card here with hip pain is that it might not be coming from the hip at all. It could be coming from the knee and radiating up to the hip. It could also be coming from the back and radiating down to the hip. And so the key is, if you're having pain around the hip, if it's in the front of the hip, the side of the hip, the back of the hip, come in, we'll try to figure out exactly where the pain is, what's causing it, with all of these diagnoses that we've talked about, and we'll try to identify a treatment plan, and hopefully we can get you better without surgery. We have an excellent physical therapist, but if we need to, we can do an injection to try to identify and isolate the exact cause, and then hopefully we can avoid surgery, but if not, we'll get you taken care of.